How you doing, brother? James Clem. What's
I'm doing
up?
well. I was in my clinical theater for a half a day today, working on emergencies though, because I'm in California, and I feel so much better about life. I'm back in my comfort zone. I picked up my Prime scan. That's part of my family. I hope you know that. And it was just amazing to be back. But you're back, and I heard you did a veneer case today.
I sure did. I did an 8 unit, well, 7 unit veneer case and an implant abutment and crown. And man, it was good to be back in the game. But I'll tell you, I got on CERC and I started using it, and I was like, wait a second, which catalog does this go in? And it's kind of like how quick it fades away.
Yeah.
But the craziest thing, I had them all in, no
Hmm.
adjustments. It was just awesome. And the power went out
Oh,
right when I cured him. Everything
oh,
went dead.
but
No
you still had
suction.
battery. You still had battery in your curing light, right?
Yeah, of course. So we were
Oh
able.
yeah, baby.
Yeah.
You got
So
them in. No,
yeah,
no,
but
no
if
let
it
micro leakage.
yeah, but if it happened like 30 minutes before, I honestly I don't know what I'd done. But anyway, it's a good day. We're
Well,
uh, we're
you're
back in
back.
Texas.
I remember this earlier in my career. I used to do a lot of oral surgery and take wisdom teeth out, and I remember taking a impaction out, and everything went off.
Oh,
And I still remember that patient as it were yesterday. And we would just have him spit in a cup until we got the wisdom tooth out. And that was the good old days.
good old days. Well, I was thinking I was going to have to go back to the Doriot handpiece and just have somebody
Mm.
like push on it and get the wheels going.
You,
I could
you
pull that one off.
know, I think they should come back because back then Dennis had really great legs, if you know what I mean.
Well, they had bad posture. It was bad. Their spines got
Yeah,
all out of whack.
yeah, but pushing those foot pedals, those legs, it was like Pilates all day on the legs.
That's right. Well, those are good old days. I got some good trivia for you.
Yeah.
What was the dental technology that allowed dentists to sit? There was a very specific thing that allowed us to start sitting
Yeah,
rather than
I,
standing.
I know our guest is going to know that because
No, he's
he's a
not.
man
He's not
of
going to
wisdom.
know. This guy.
He's a man of wisdom. I'm
You got?
passing the buck right now.
Did you have any idea?
No, tell me.
No, I'm not going to tell you. I'm going to tell you at the end of the broadcast.
Uh, well,
Nah.
audience, you got to stick it out with us so we know. And I'm sure, in fact, if you know this, post it right now. Post it
Yeah.
right now.
No, I'll release you. It was the air-driven handpiece.
There you go. Yeah,
Yeah,
I
because
remember. I remember.
The Doriot handpiece, you got to stand. But anyway,
Hey,
all right, let's move.
Todd, you may not know it that when I first started practice, my first practice in the hygiene room, I had a belt-driven slow speed, and we used that for a good 3 to 4 years. I bet you didn't know that, did you?
No wonder you have such great legs. That's awesome. That explains so
You got
much.
it. You got it. Yeah.
You
Thank
got
you.
you got any deep thoughts for us?
I do, and it's a good segue to our incredible guest, Dr. Mark Fleming. He's a positive thinking man, and I was sharing with him in, before we came on when we first met in our journey. And this is by Norman Vincent Peale, The Power of Positive Thinking. Whenever a negative thought concerning your personal power comes to mind, deliberately voice a positive thought and cancel it out. And that's what we have to do. Like when the power goes off, Todd, this is a story you're going to tell your grandkids. And I know Mark has lots of stories to tell his grandkids.
Mark Fleming,
Just a few.
There he
thanks for
is.
joining us, brother.
Glad to
Thanks for
be here, guys.
yeah.
Glad to be here. Thank you.
So
Mark,
what have you been doing in all this downtime? What's your story?
Basically working from home. We're still doing things with CDOCS and Spear, but campus was basically shut down in March 15th or so,
Hmm.
and we'll stay closed until the 31st of May.
okay.
So
Oh.
lots of stuff working at home. Learning how to go to the other side of a digital world and connecting with people. But it's been a very interesting experience, to say the least.
Yeah.
Mark, you folks have one of the nicest educational campuses I've ever been to.
Mhm.
How are you guys planning to do a group there? Or what are some of the shifts you're making to make sure the groups are safe, and how are you setting up the 6 feet, or how are we going to process that?
Actually, I'm not sure yet.
Okay. We're still working through that.
We're still working through that. I know possibly some of the courses in Charlotte, when we go out there, we may break it apart into 2 classes, even though there's one course going on for some of them. But otherwise, the executive team is still working on that and working that out. So I'm sure they'll come up to make sure everyone's safe, participants and people, support, and those giving the courses. I have no doubt about that at all.
Yeah, we're just all working through this, aren't we?
We are. Well, I'll tell you a story about that.
Yeah.
It's hard to believe that I may have a story about something, but it was actually the weekend before everything broke down. So it was like the 12th of March, and we're sitting in a meeting because we're going to be doing an assistance course, and one of the people in there said, "Man," he goes, I've never seen anything like this. And I turned to him and I said, "You know what? You live long enough. That won't be the last time you say that." And, that's one of the things, and I know we're going to talk about this later on, but we're constantly being thrown curveballs, and we can rebound and recover from just about anything. And I truly believe that. And I think after this gets going and everything, I really believe dentistry is going to be even stronger, because I think now from the delivery of it, we felt the loss and we want to get back to it. But I think that's going to be the same with the patients. You never know what you're missing until you don't have it.
Oh, that's so true.
And I think I really believe that's what's going to happen here with us.
Mark, I'm getting some of my CE online because I couldn't get to the AACD where I needed 9 more units. And I'm on Dental XP, which, they have great content there. And I was watching a video on switching from analog implant placement and planning into digital. And what was amazing, and this is what they said, and I know all of us here are involved with this, they're saying when you go digital, you can use less appointments, and the technology decreases the probability of error.
Definitely. Definitely.
And that hit me so strong, because I'm going, everything we're doing, particularly since we're all involved with the digital platform in a lot of the things we do, I think we're at a point where we definitely can say we can decrease clinical error and use less amount of appointments to get the project done. And that is what we need now. I think the offices that have pivoted to that, or they're going to do that soon, are going to have a better advantage to be more flexible in what they do. What's your perception at your institute of what you guys are thinking on that?
I really agree with that. Our sister company, Spear, has a management company called Practice Solutions, and they're gearing their people for what they call at risk, or what I call prone to possibly pick up something, because I don't like putting the age thing on it, especially with someone like myself that's chronologically gifted. I stole that from Glenn Hamp, and after twice, I never gave him credit for it anymore.
Mark, how's my makeup today?
You're doing well. You're doing very well, James.
Okay, go.
I think with the technology that we have nowadays, we can cut down on the visits that you alluded to, that are going to be more precise in the treatment that we're giving. And that is in essence what's going on out there is helpful for our patients. Less visits, not subjected to, everything that's going on out there. And if I can still remember, which dates me also, before universal precautions. And since 84 and whatever, there really hasn't been a safer place than a dental office. And
That's right.
I think that was forgotten in this last go around,
Yep.
how invested as a profession that we are and how caring we are about taking care of our patients and being with an infection control. I mean, we're top dog. Okay. I mean, we do it every day until they cut us off. And I think that's another reason why we'll come back strong, because we were already heavily invested in that, taking care of our patients and doing it safely.
Yep.
Mark, you and I have a lot in common, and we can probably maybe be a little mentor to Todd right now, because you and I, we didn't wear gloves when we first started, did we?
Exactly. Well, that's interesting you say that, James, because I actually worked in surgery for 2 years as a surgeon's assistant before going into dentistry. And when I got to dental school, I was thinking, why aren't you guys wearing this? Why aren't we wearing this? And then when everybody went to it and they start complaining, well, I can't feel anything and I'll have a mask on.
Oh, yeah.
I'm thinking, dude, you should have been there already.
The good thing is, when I took over my practice, I went in there, and the prior dentist, who was a great guy from USC, had towels that he would use for the whole day just to dry his hands off on. And I thought, maybe I should change that protocol. Can you imagine that's what we used
just
to
a
do?
smidge. Yeah, those were the days.
Todd, what do you think about that? Sorry, Todd, what do you think about that? Those were the days. Go ahead.
No, I am older than you guys may think, but we've all been in this CAD CAM little game for nearly 20 years, all of us, and one of the questions that we've asked pretty much every guest is this, and I know we're biased. The three of us couldn't be more biased than anybody else in the world. So whoever's watching, we know that, and what we're getting ready to say is
we admit to it.
Yeah, we admit it, and it comes from our heart. But anyway, here comes the question. Even through all this COVID delay and stoppage and fear, do you think it would be a good time to invest in technology? And you don't have to say yes to CEREC or anything like that, but technology in general.
Actually, this is the time to do it. This is when people invest in themselves. I was listening to someone today that McKinsey has done a report that looked at the .com bust, the 2008, 2009, and this. And the companies that grew out of those heavily invested in themselves right before things began to take off again. So I'm not saying willy-nilly just go out and start spending mad bucks on anything. Have a plan, know what you want to do, and know where you want to go, and then have that belief and invest in yourself.
Yeah, the other, so now more chairside CAD/CAM related that we're a part of and we teach. It's always been like we're trying to get into the tech. What's the adaptation curve, or what do they call it? And it's always like, when are we going to start making this mainstream? And it seems like it's kind of stalled. And now I look at it like, who would want to go to a dentist twice, especially after all of this?
And actually, from a safety point.
Yes, right, exactly. And
get it done, and get it done now.
And also, I love my patients, but I had 2 this week already that came in with their mask on, and I was like, you gotta take it off, So, when they're thinking like that at that maybe simplistic level, why take an impression? Come in and get it done and be finished with it. And so I think if anybody's out there really thinking about any chairside CAD/CAM system, whether it's CEREC or Plan Mecca or whatever, you got to go for it. Now's the time to swing for the fence. That's what I think.
Yep.
Anyway.
And I think you'll be in the best position, taking care of patients, like you said. Now's the time.
And, I'm looking forward to the companies that we have association with, where they can provide a easy end to this, where, let's get into this. Maybe no payments for a year and low interest now.
Yeah.
There's no better time than to take that risk. I know dentists as a whole, and we've been around a lot of them, haven't we, Mark and Todd?
Yes.
And even myself, I have a tendency to naturally be a little more conservative, and that's good. But it wasn't until about 45% away through my career where I started to think bigger. I held on to one lab for years, way before Sarek, just because I'm so loyal. And I when Empress came out, I knew I had to branch out because I couldn't get those services. And that's the best decision I ever made. Not that I didn't want to be loyal, because a lot of people don't want to go to CAD/CAM because they're loyal to their labs. But it's about controlling your future and destiny and taking that calculated risk to have more control on what you do. And I know that's the message we all are passionate about.
Yeah, definitely. I talking about times and things that happen to you and is there a reason or not? I think back to several things. One, when I branched off in my own practice, it was 1984. Lori was 8 months pregnant with our second son. We moved into a house, and the buy down percentage was in the high teens, and prime was 21%.
That's right.
And when I bought my Sarek, it was a month after 9/11. But you have the belief in what you're doing and where you're going, and if you don't swing, you'll never hit the ball.
Exactly. Yeah.
And
I like what you just said there. You've got to have the belief, and then you jump with it.
Exactly. Right. So I enjoy. I CAD/CAM. It just makes dentistry fun for me. It's creative. I mean, someone like both of you guys are tremendous at what you guys do. And then from the teaching aspect of being able to show people how this can impact their practices and impact their patients, it doesn't get much better than that.
It is.
Well, it does get a little bit better because when you meet those people, and then they come back and they say, "You changed my life." I mean, that's the moment in time. It's like we really had an impact on their life. So what are you doing to discuss with your team, your family, maybe some of the students through CDOCs? What are you doing to help get them through this? What are you giving hope for?
We're trying to we're keeping them engaged, with webinars and there was social media. We were just beginning before the shutdown. Decided to get more invested in that. So you see, Sam Purry and Mina Barsom and Doogie. Mike Scramstead. Putting out tips of the
What
day.
did you call him?
We get it.
Doogie Howser.
There you go.
We still refer to him as that.
We love our genius Doogie Howser.
Yes,
he is a genius.
But also at the same time, helping keeping their chins up. We're watching as James shared, about the loan situation for what he was going through. I watched people talking about that on the boards and trying to have their states decide what kind of protective gear are they going to do? Do I take the money? How do I get my staff in? How do I allay the fears of my team members, the potential fears that they have coming back in? There's a lot of stuff going on out there, and sometimes it's helpful for them to just have a place to vent and get some positive reinforcement. So we've been doing a lot of that also.
Well, venting is therapy, right? It's group therapy.
Exactly. And not holding it in. So
and to know the fact that others are feeling what you're feeling, and I know Todd and we've mentioned multiple times after our shows, wow, we were blessed. Wow, we were the ones who were blessed. And it's true. And I mentioned beforehand, doing these live webcasts have kind of rekindled my first love of dentistry. I was at the office today and getting a few things and projects that were on the back burner caught up, and I was enjoying it. I was actually steaming the floors and making sure everything was clean, and my dog's with me, and we're just having a good time. And when you have that first love, it gives you passion, and I think we all need that first love experience again. And I know CAD/CAM and digital platforms have helped elevate that first love for me. But it still goes back to the basics of knowing that we're blessed. And Todd, you said this, just being back at work, we are so blessed that we can do what we do.
Yeah.
Yeah, we are. There are so many people that would love to have our problems, I mean, and we're blessed. And dentistry isn't the easiest job in the world by any means, but we're independent. We can make our own, determination on how we go through our careers, and we can make more money, less money, whatever it may be. And as far as the choices you make in a practice, you can choose on what kind of dentistry you want to do. I mean, how many people at a 9-to-5 job get to choose what project they're working on? I mean, we're very blessed. So anyway, hey, I gotta read some love that you're getting here.
Yeah.
And she's good looking, so I gotta say, Jennifer Beckering, she says, one of my favorites right there.
One of my favorites, yeah.
Yeah, and then my wife even gave you a shout out. Where is she? Christine, my wife, she says, hey, Mark, good to see you. So
good to see you also.
Yeah, your wife and my wife, we've had some good times.
Yeah.
Good dinners.
I mean, especially, Sarek 20 when we busted out. The first time. That's
right. Yeah,
that was some good times there.
So I gotta let everyone at least know how Mark and I met. Mark Fleming and I, we met online, and it was very odd for a young boy like myself to meet an older gentleman online the way we did. So
chronologically gifted. Don't judge me. Don't judge.
I was very, very afraid, but no. We were both early dental townies, and we were on Dental Town, and got to know each other very well. And you became famous on Dental Town. This is 2000 to 2004-ish, and it was called Friend of Phlegm. And so everybody was so excited.
Todd, you made me famous. You made me famous with that world famous gift until Dental Town made you take it off.
Yeah, I made a little motion picture that said "Friend of Phlegm," and it was all over that website.
Oh, Friend of Phlegm.
Yeah.
Do I have permission to be part of the Friend of Phlegm?
Sure.
Oh, yeah. What are you getting ready to show us? Well, but the funny thing is it started showing up in advertisements. Right?
I know.
Oh.
So tell everybody about this. This is pretty fun.
Well, which one? Go ahead.
Just how did Friend of Phlegm start?
So I met Darren Greenhall once again through Sarek, and we met Rich Rosenblatt at the ACD. I don't know if it was called the ACDNA yet or whatever in Montreal. Actually, it was the first time I met Michael Dunn. The whole thing, and Alex Touchstone. So it was a big happening there, and we all got together. And then we met then at Chicago, and I think it was at the Townie meeting. And somebody said something to me, and I said, well, I don't know if I want to do that. And Darren Greenhall goes, well, do you want me to kiss your ring, sir? Since you're done. He goes, or is it okay just to be a friend of Phlegm? And then he just kept pounding that, and it just took a life of its own. And if I had a nickel for every time, I wouldn't even be talking to you guys now because I'd have my own eye.
Well,
and I'd be off and running.
Hey, Todd is trying to pivot this show, right?
Yeah.
Let's bring Friend of Phlegm back and make it the hashtag of the day.
Yes. No,
it was fun. It was fun.
Yeah, I had a blast. It was a good time. And then both of us, you and I, were administrators on Dental Town for a long time. Are you still
Yes.
doing that? Are you still a part of Dental Town?
Still part, with Hogo every once in a while. I try
Yeah.
to check in. The time is shrinking down. So even
Mhm.
though when I go into the office, I have 3 screens that I'm on before I pivot and go to the CEREC machine with another screen. But I check in every once in a while. Some good friends on there, and it's about relationships, and
Yeah.
you never want to break those off. You maybe pulled away for a period of time, but it's always nice to get back and see people and talk. I mean, just being with you guys here tonight,
Yeah.
it's good stuff. Good
You know what?
stuff.
I'm gonna say one thing. I bet you're like Kevin Bacon. I bet you're 7 degrees from every dentist in the United States.
I, you know, I, I would have a hard time doubting that myself.
I bet you are. I bet there's at least 7 degrees you could find every dentist in the U.S. At least.
Uh, you know, if not, then other people in the industry. Let's put it that way. I mean,
Yeah.
Jennifer coming on and saying that, it's fun to, especially when you're working with different companies and things like that. Work with Dentsply Sirona, people there, and I work with Ivoclar, and you know people there, and Vita. It's not only the companies, but it's the people that make up the company. So when you go to these meetings, you go for to see the company and see what they have, but you also it's catching up with the people that you haven't seen for a while. So
Yeah.
that's a real important part of all this.
Mark, I have a question for you, because I know you had a dynamic practice for years, and then you made this transition into more of a teaching environment. You're there at Spears, CDocs. How's that transition been for you? You've been there, for over 10 years now?
Well, I've been with Sam and CDocs teaching since 2007.
Okay. Yeah.
Sold the practice in Florida, and I don't know if you guys noticed that my one arm is longer than the other from patting myself on the back. Right, James. It was a kick-ass practice in Florida.
Yeah, that's what I heard.
But we were going more and more, and we were going to get busier and busier. And Sam and MTI said, you may want to think about moving on out. And I jokingly say I came home and was talking to Lori, and I said, how would you like to go on an adventure? And she says, so what's that mean? I said, well, nothing too big. Sell the house, sell the practice, move away from the kids, and go on out to Scottsdale. I have really enjoyed it.
Yeah.
You talk about being blessed. She and I, we've reinvented ourselves at different times in different ways. And this 2000, end of 2011, beginning of 2012 was another time for that. So I had a practice for a short period of time out here, but I was still doing a lot of work with Spear and CDocs. And then 2014, sold the practice there and went full time, and couldn't have made a better decision. It's been fun.
Wow.
I miss dentistry, although I do get to practice a little at the center, trying out new materials, working on the patients. More or less are the employees there at Spear that need some work done. I got to tell you, I don't miss the business aspect of dentistry at all.
I hear you.
I still really do enjoy the clinical aspect, as long as my hands and my eyes stay good, and I'm still stoked to do it.
Hey, Mark, I'm going to pop up a picture of you and a grandbaby in the pool.
Oh,
there's a great little picture of you. The baby doesn't look too happy. He's holding a little Michael Jordan basketball.
Yeah, he is. Don't worry about it. No, I was telling James beforehand. it's been fun to have him so close. And they weren't here when Lori and I moved out here, and we got a surprise call after Christmas one year. We were actually back in Orlando visiting them, and they said, "Hey, we both got promotions." And we were saying, "Great, that's good." And then they said, "Well, don't you want to know where we're going?" And said, "Well, okay." And they said, "Both of us are, we're coming out to Phoenix." So on their second honeymoon, they moved out. They lived with us for 9 months.
Nice.
It's great. And then Booker is now 2 years old.
Booker. Oh, what a great name.
Yeah.
Booker.
He's quite the man, and it's been fun watching with him and everything. And he's been a real blessing also. So it's been a cool.
Well, Mark, I'm a fan of yours, and I follow you on Facebook, and I admire how you are friendly. Everybody I talk to who knows you just say he's just friendly, he's inviting, and it's just an honor to know you and know the fact that you're educating people. I had professors like that in dental school that still impact me in my thought process. And, we're at that stage in life where we're passing back to the next generation of dentists, and to have fun and to be involved in that. I would say this has been the greatest honor of my career, is to be involved in giving something back. And I know you are the one I think about when we do that. I know we don't spend a lot of time together, but whenever I see you at a convention or show, you're just the first one to say hi and give me a smile. And I've really cherished that through the years. But I am a Facebook fan. I hope you know that, because I saw fact that you, just a while back, you were the sexiest man alive.
It's amazing what Photoshop can do. It really is. It really is.
How did that go down for you? Was that something they were pulling on you there?
I have no idea. There was some, unfortunately or fortunately, I have some really good friends that are very skilled at that. So you have to be really, really careful sometimes of pictures and whatever. You brought up a good point, and I'd like to circle back about the teaching aspect, because and talking about, because there were people in dental school, because dental school as a whole, a lot of times isn't that positive. They're kind of beating you down for 3 or 4 years, and then they wonder why you never give any money back to the school. But that's another subject. But I always wanted to teach. And of course, when I got out of school back in, right after the invention of electricity, the only place where people taught were in dental school. And I knew that wasn't going to happen because I had authority issues. So, when Sam first approached me to start coming out to Scottsdale when I was still in Florida, I jumped on it because it was something that I wanted to do, and have, watching people like yourself and Todd and other friends who are doing it. We learn a lot, but for us to learn a lot means that had to be given to us. It's our choice to take it in and do something with it, but there had to be somebody that mentored us in a way and to do that. And I think dentistry, at times is lacking that. So I want to be in a position, I'm glad I am in a position to be able to give back, to help people navigate certain things, or give them the experience without telling them what to do, asking them if they'd like to hear some experience, and then have enough information to make an informed decision on their own.
Exactly.
Wow. That's beautiful. That's beautiful, Mark.
Mark,
you know what? We're kindred spirits. We're kindred spirits. And we're kindred aged.
Yes, we are.
Well, that's because you guys didn't wear gloves back then. It affected you. That's why you guys are so wacky.
Well, when I was wringing out that amalgam and seeing the mercury slide around the room,
on the cheesecloth. You probably used a cheesecloth, didn't you?
And Todd, we'd always chase it so we wouldn't lose any of it, so it'd be there for the next time.
Exactly.
Now you know.
It explains so much, these Mad Hatters. Mark,
maybe that would explain my disposition now. I don't know.
Or not.
Yeah, exactly. Or not. But Mark, you're a blessing, man. Thank you so much for coming on and joining us today.
My pleasure, guys. I appreciate it.
You're one of the true kindred spirits in our little CAD/CAM world. So thank you for being a friend.
And I'd like to say this and acknowledge the fact that our little niche of CAD/CAM, the dense supply runner world, is a better world because you're in it. And thanks for coming on. I really do mean that from my heart.
Me too. Yeah.
Thanks, guys.
Thanks, Mark. James, have we had some great guests this week? It's been awesome. I love Mark. Mark's a great guy.
Mark and I share a lot of history, though we didn't know each other earlier in our career. We kind of went through those same building blocks, and I really admire the fact that he's giving back to people. And I'm still practicing, but I know in the future I can't practice forever. I'm doing pretty well yet, but my body's starting to hurt a little bit, and I actually feel like I'm at my prime. From my intellectual understanding of what I'm doing, my experience gives you a little bit of wisdom and insight and like people, but I do have to admit my body has quit hurting with this downtime.
Yeah.
In fact, I have not taken an analgesic since we've been down, and I was taking a walk this morning with my German Shepherd, and I was walking like I did 15 years ago, and I'm going, man. So I think probably in the future I'm going to make more of a transition into more education
that isn't what it is. That isn't what it is. It's all your neighbors smoking pot. It's all coming out the windows, and you're just getting a little secondhand smoke.
I know Mark doesn't do that. Here's my new.
We should ask Mark Fleming about that. That's what we should ask that guy.
Here's my new saying from Mark is, I want to be like Mark.
Hey, well, I got to say one last thing about Mark Fleming. How bold. We've been talking about being bold, through all this. How bold was it for him to move from Florida, sell his practice, and move to Scottsdale? I mean, I remember when he did that, and I thought, man, that guy,
work it through with his family and his wife and leave his kids. And I know his wife is a gem. She's a minister, a powerful woman and with wisdom. And I know he's a blessed man, and I think he knows that too. Of course, he says that.
We're all better people because of our wives. There's no doubt about that. Yeah. Hey, let's wrap this up. We've got Tarun tomorrow. Tarun's coming. Tomorrow.
That's the morning, right? 9 o'clock.
We're gonna do it. Yeah, we're gonna do a morning show tomorrow, and then.
Wait, 9 o'clock Pacific time.
I'm not gonna tell you. I'm just gonna start it without you. Yes, of course. 9 Pacific. And then
on Sunday?
Yeah, on Sunday we've got the king of comedy when it comes to dentistry, and that is Mike DeTola. So pretty exciting. He's going to be quite fun. That'll be the evening.
It was interesting. When he was on, and I was back there, I don't know, when was it, the 27th, and we had some fairly famous comedians coming on after him.
Yeah,
They were listening to him, and they're going, I was watching him, and they're going, he's really good.
Yeah, it was when I can tell you exactly.
He was killing it. He was just killing it.
When Steve Martin and Martin Short were on, and I was like, I'd rather listen to Mike DeTola any day. But anyway, all right, everybody, thank you so much for joining us. Thanks to Mark Fleming, good friend of ours, and we'll see you around.
Be safe, and keep your mindset. Look forward to the future with grand thoughts.